All right, you feeling sick? Well, take a number because the doctor won't be seeing you now. Hi, everyone, and welcome. I'm Neil Cavuto. And while the president is touting those 8 million people signing up for Obamacare, critics, including some doctors, are saying that still does not mean those 8 million people will be getting quality health care or much of any health care. Now, we still don't know how many have paid into the deal, and we still don't know how many doctors will be included in the deal. So forget about keeping your doctor. You might have trouble finding a doctor. Glad to see this gentleman back. Ben Stein, we got Charles Payne and Dagan McDowell, along with Adam Lashinsky and Charlie Gasparino. So, Charles Payne, what do you think of that? Much harumphing, but a lot of doubting.
Well, I think you kind of knew that when the president did a victory lap on Thursday at 3 o'clock before Good Friday. Having said that, it was a little bit basic math when they talked about this already, whether it was 46 million or 31 million. We're going to put a lot of people in the system. So we knew there would be more people, less quality care. But now that doctors are abandoning it, it feels like our greatest worries are probably going to be even worse than we thought.
Ben Stein?
Well, the basic thing about this is you can sign up as many people as you want, but there aren't any new doctors. You sign up 20 million more people eventually. I mean, not so far, but eventually, let us say. But there aren't any more doctors. It just means longer waiting times, longer times getting an appointment, less time with the doctor. There's something basically wrong with this equation.
And a lot of doctors are just passing it up, right? If they had their druthers dig and they don't want any part of it.
A lot of doctors are over 60 and they want to retire, and this latest deluge of paperwork and Obamacare red tape is making them say, let's hit the golf course instead of hitting the red tape.
Or they make you pay in cash and they don't accept insurance anymore, which you definitely see here in New York City. But many insurance companies that are offering plans in the Obamacare exchanges are offering ones to keep costs down, that have access to fewer doctors and fewer hospitals, and people more and more are discovering, hey, I've signed up for this plan, but I can't go see the doctor of my choice. In many state exchanges, you can't go see out-of-network doctors, period.
We had a problem attracting smart people to become doctors for a long time. I mean, my brother's a doctor. He's been through the medical school.
Wait a minute, what are you saying? We only attracted dumb people?
Many smart people that are good at math and are intelligent are going to other professions that they can make more money. And this is one more reason not to be the doctor. The other thing that scares me is we don't have any good statistics on who's paying into this. I mean, that's a recipe for disaster. This thing, the president does the victory lap when people sign up. He doesn't do the victory lap when people pay in. That's a big problem.
That's a very good point.
There may not be a lap to take a victory lap on. I mean, really.
That's why they're not talking about it.
Yeah. All right, Adam?
No, they're not. No, they're not talking about it because they don't have the data yet. And
Why?
I'm just so.
They knew where Osama bin Laden was hiding out, and they don't have the data on Obamacare. Give me a break.
Adam, I do love you to death.
The data would come up instantly.
Adam, I do love you to death, but they seem to have the data when it's going their way. Miraculously, they can't find it when it's not. But Adam, go ahead. I'm sorry we all interrupted you and we're this rude. No. It is not Holy Week behavior, but go ahead.
No, not at all, Neil. I'm just pleased once again to be able to play the optimist on this program with all of you negative people, because you're focusing on the negative here. You're focusing on what might not be working.
You sound like the cruise director on the Titanic. What do you mean the optimist?
No, I totally disagree. I mean, you're focusing on, well, maybe some people might not be able to get the doctor of their choice, or maybe some doctors might choose not to treat. No, it is some, because a lot of people are getting treatment. A lot of people are having health insurance for the first time. Just to finish one point. Hold on, an important point. We know we have the data when people sign up. We don't necessarily have the data if their credit card is cleared yet or their check is cleared yet.
You know what's great?
We will.
Go ahead, Ben.
Adam, with the greatest possible respect, imaginable. That is true. With the greatest possible respect imaginable, that data would come up automatically, and we know that 5 million people have either left or lost their insurance. So the net gain, if you deduct the people who haven't actually paid anything for it, might be very small indeed.
I just wondered about with Adam, though, because a new wrinkle was added here. We don't know if their credit card is cleared. All I know is they don't let me leave an Italian restaurant until it's cleared. They do not, especially any of the Gasparino goes to. Well, unless they want to break my arm. But I mean, Dagan, what do you think?
There's some hard data, though, and I think that we're focusing on doctor choice and hospital choice, and that will play out in months and years to come. How important is that to people who did have insurance prior? It's incredibly important, and that will turn the tide against Obamacare. Can I quickly?
Yeah, please.
There are stats, though, that Forbes looked at compared private plans and Obamacare exchange plans offered by the same insurance company to see the option of doctors, looking at 6 different types of doctors in 9 states, 54 instances total. There were only 2 cases where the private plan and the Obamacare plan offered the same number of doctors. In 52 instances out of 54, the private plan had more doctors.
Here's where I have an expertise. Gaspo, here's where I have an expertise over a lot of you.
Yeah.
I know a lot of doctors. Okay. I deal with a lot of doctors. Doctors are friends of mine. And not a two can agree on this. Not a 2 nurses, not a 2 radiologists, not a 2 MRI specialists, not a 2 can really understand what the hell's going on. And not a one that I talk with, and some of them are big fans of the president, like this. Now, anecdotally, that might be small, but this is a pool of about 17,000 doctors I deal with. Yeah. So I'm telling you, there is something in this here.
Listen, my brother's a doctor, runs an ICU, works in an ICU unit.
What happened to you?
I got involved with you.
Okay.
And, listen, he's not ideological, but ask him to define what's going on, and he can't. And he's a really smart guy. MD, PhD.
Let me make an important point,
I will also say one other thing. There's one number that matters in my book as a business reporter, and this is what I don't get, why Adam is believing everything coming out of the president's mouth. How many people have paid in? How many people have paid in? We do not know. Normally, journalists that are skeptical, like Adam Lashinsky, business journalists who wouldn't accept that type of BS that we don't know.
You'd look at the number. You're exactly right. You'd look at the number.
Accepting it from the President of the United States, and that's outrageous.
Okay, so let me answer that. Let me answer that. First of all,
you just said, Adam, by the way, you didn't know. You didn't know that number.
Well, I don't know whether they haven't.
Go ahead, Adam.
Let's give them. Look, I'm perfectly willing to be skeptical. I don't know. I'll give them some time. But I just want to make sure.
You would never say that to Apple's PR department. You would never say that to Apple's PR department.
Maybe yes, maybe no.
Definitely
look,
no.
These people have big jobs, Charlie.
That's a great answer. Maybe yes, maybe no.
I wouldn't.
Maybe
if
yes.
I could just make one quick point, Neil. If you asked all those healthcare professionals, those wonderful people that you know so well, how they felt about things 5 years ago, I don't think they would have told you everything was peachy. They would have said, we've got big problems in the health insurance.
They at least knew and had the system that was, and they at least knew what their responsibilities were. I'm telling you, it is not that way. They just don't know which end is up. So most of them tell me, Neil, here you go. There's a form, you figure it out.
Mr. Obama doesn't know which end is up. No one knows which end is up.
How can we know which end is up when there's been like 35 arbitrary changes to the thing before it was even cemented? One thing that came out this week that the White House isn't talking about is this Gallup poll that shows that 85% of people who were uninsured before the law are still uninsured. That's a frightening thing. You add that with the few people who might have actually paid, and this is something of an unmitigated disaster. It's
well, that's a very good point in the end, that if this was all done, Dig, and you think about upending our entire healthcare system, whether it was good or bad, for the 10% roughly who didn't have coverage, whether that was accurate or not. And now 8 out of 10 of those don't either want this or want anything to do with this or can't afford this or for whatever reason aren't part of this. Then what the hell did we do all this for?
We did it for political reasons then.
Wait a minute.
We've turned, and the issue, you talk about ripping up the entire healthcare system. I don't think we'll really know what we have in terms of a healthcare system for maybe decades from now. And it will be the people who have to drive past a hospital to go to a different hospital. They can't go to the one that's closest to them. They can't see a doctor that they used to see because of this insurance that they're buying.
But you're right about the political. This has been the Democratic Party mantra and for liberals. Since Clinton. And when his wife, we had Hillary Care, which is going to be probably the albatross around her neck if she runs, because it's literally the same thing. They've been trying to get this done for years. They finally had the perfect storm, and now we're stuck with it.
I will say this. I wouldn't let Charlie give me a spoonful of Robitussin, so he picked the right career.
I might, just for the hell of it, just to see what happens.
You wouldn't want to have baked ziti with me? My baked ziti?
I just wouldn't want you cutting me open.
Yeah. Could you imagine that? You get the baked ziti and Robitussin. All right, well, tax